At the Visitent Hospital near Lyon, mobile psychiatric teams are transforming patient care. Doctors and nurses now visit fragile patients at home, aiming to prevent relapses and crises. This approach fills a critical gap after hospital discharge, when patients are most vulnerable. It's more than treatment. It's a safety net that reduces emergency visits and creates continuity. For many, it's the difference between isolation and sustained support. Each intervention begins the same way: a doctor and a nurse, side by side. They track patients recently discharged or in crisis, offering tailored care. For example, a 25-year-old woman facing suicidal thoughts now receives 3 home visits per week plus daily calls. This intensive model not only prevents relapse but uncovers hidden trauma, giving patients tools. Mobile psychiatry is more than medicine, it's about trust. Many patients, often isolated, rediscover a sense of connection. Doctors describe this service as a new puzzle piece, reaching people who once slipped through the cracks. By adapting to missed appointments or sudden crises, these teams prove that flexibility can save lives. The impact is tangible. In Lyon, emergency psychiatric admissions have dropped among patients followed by mobile teams. Families say they feel reassured, knowing professionals are only a call away. One mother of a young man with schizophrenia described the service as a lifeline, preventing repeated hospitalizations and keeping her son stable at home. Yet challenges remain. Recruiting psychiatrists and nurses is increasingly difficult, as France faces a shortage of mental health professionals. Mobile teams require high motivation, long hours, and resilience to burn out. Experts warn, without sustainable funding and better working conditions, this promising model risks being stretched too thin. Another hurdle: coordination with general practitioners and hospitals. While mobile teams bridge gaps, communication silos persist. Some doctors admit they rarely receive updates after patient visits. Advocates argue for integrated digital records and shared protocols, so home-based psychiatry doesn't operate in isolation, but as part of a continuum of care. Despite obstacles, patient testimonials remain powerful. A man treated for bipolar disorder says he no longer fears relapse because someone always checks in. Another young adult, once revolving between ER and wards, now studies again thanks to regular home support. These stories highlight that psychiatry at home is not a luxury. It's often the key to recovery. The government has taken notice. France's National Mental Health Plan includes scaling up mobile psychiatry nationwide. Pilot projects, like in Lyon, serve as blueprints. Officials emphasize cost savings, fewer hospital stays, better long-term outcomes, and reduced social burden. But scaling requires political will and commitment beyond pilot phase. Ultimately, mobile psychiatry illustrates a shift in mental health philosophy. Care doesn't stop at hospital doors. It extends into homes, families, and communities. By combining medical treatment with daily presence, France is redefining psychiatric care for the 21st century, a model blending humanity, prevention,